Hello, my name is Carol Hansen, and I am one of the outpatient lactation consultants at UCSF. If you're listening to this, you must be in your second trimester of your pregnancy. Congratulations. Today, we will talk about some suggestions to help best prepare for the birth of your baby, practices that will help make breastfeeding successful, such as how to recognize your baby's hunger cues, how to obtain a breast pump from your insurance and how to rent a hospital pump, and the lactation support available to you and your baby once you're home. In addition to signing up for breastfeeding classes, we highly recommend that you and your support person or partner prepare for childbirth by attending 2 classes called Childbirth Preparation and Pain Relief in Labor. These are available through our Great Expectations Pregnancy Program. You can call to register or go to the UCSF Women's Health Resource Center website. We do have some scholarships available. Pain and pain relief are natural parts of the labor journey. UCSF has many options for coping with labor pain. Regardless of which pain relief option you choose, breastfeeding can be very successful. Studies show that babies can be particularly alert and ready to breastfeed after an unmedicated birth. UCSF has options for women that wish to have unmedicated or minimally medicated births. We have warm baths during labor to help you relax, cordless fetal monitoring that allows you to move around and change positions while in labor. Our midwives, nurses, and physicians can help with relaxation techniques and breathing techniques that are known to ease the discomfort of labor. We offer midwifery care to all of our patients, and nitrous oxide gas is available, which can lessen pain throughout the labor process. All options for pain relief are discussed in the Pain Relief in Labor class. After delivery, your baby has many ways to tell you if they are hungry and ready to feed. Breastfeeding and your milk supply both begin at birth. You may have heard about cue-based feeding and feeding on demand. Feeding your baby when they show signs of hunger will help lead to a satisfied baby and a full milk supply for you. In the first few days, babies will eat many times a day. In fact, the second day we often refer to as the all-day cafe. After that, it is normal for babies to eat 8 to 12 times in 24 hours. Because babies are programmed to know when and how much to eat, we advise parents to watch your baby and not the clock. Healthy newborns let you know when they need to eat by communicating with their special cues. Examples of feeding cues are things like they stir and they start to move their arms and legs. They open their mouth. They flutter their eyelids. They make sucking movements and they stick out their tongue. If somebody's holding a baby, they might turn their head toward that person's chest as if looking for the breast. This we call rooting. Sucking on their hands is one of your baby's clearest signs that they are hungry and ready to eat. Noticing when your baby is signaling that he or she is ready to feed has many benefits. Cue-based feeding will help your baby be much more settled and content because they're receiving the meal they asked for. It helps prevent breastfeeding complications such as oversupply, undersupply, plug ducts, or mastitis. It helps you have the really good milk supply you want. And it helps your baby get exactly the right amount of food for them because your baby is choosing the size of the meal and regulating your body to make the milk that they need for the size that they are. Cues are so important to follow that we also suggest avoiding the use of pacifiers in term babies in the first 3 weeks. When pacifiers are not used, this allows you to observe your baby's hunger cues much sooner and feed your baby more frequently and according to their timing. We know that whether formula or breastfed, babies feed when they show signs of hunger. Breastfeeding babies are less likely to be overfed and they are also less likely to cry because they are more satisfied. Now I would like to give you some guidelines about when and why, or why not, to pump in the first few weeks postpartum. And then we'll talk about how to obtain your personal pump through your insurance. There are no restrictions on how often your baby should feed at the breast. However, it is important that newborns feed a minimum of 8 times in 24 hours. If your infant is latching comfortably, breastfeeding well, and gaining weight, this means your body is stimulating your milk supply and there is no need to pump. In this situation, we actually recommend not pumping for the first 3 weeks to allow your baby to establish your milk supply for them. If your infant is not breastfeeding well, your milk supply is not increasing to match your baby's needs, or for various other reasons, you may be asked to pump in the hospital and when you return home. Milk must be expressed in order to make more milk. Your goal is to pump the full amount of milk your baby needs as a supplement and seek lactation support to help resolve breastfeeding and/or milk supply issues. Pumping and feeding extra milk is usually temporary and can be stopped once your milk supply has increased to meet your baby's needs and your baby is latching well to your breasts. Lactation consultants in the hospital will help you to know the amount of supplemental milk to pump and feed your baby, and the outpatient lactation consultants and your pediatrician will help you further once you are home. If you're wondering how to obtain a personal breast pump through insurance, here is the basic step. You need to call your insurance provider and ask for the specific instructions that they will give you to know how to order your breast pump. Hospital grade pumps are available to rent from the Women's Health Resource Center at UCSF. On your day of discharge, if you have been pumping in the hospital or if you are giving your baby donor milk or formula, it may be advisable to rent a hospital pump to help increase your milk supply. Remember to bring the pump kit plastic parts home with you that you have been using in the hospital. At UCSF, we offer many options to support your learning before you deliver and help you with your breastfeeding goals after your baby is born. UCSF lactation services include breastfeeding classes and pump rentals, prenatal lactation consults by referral, outpatient lactation consults, and the wonderful breastfeeding support group called Milk. If you are experiencing breastfeeding difficulties or have breastfeeding questions, we highly recommend that you seek lactation support within the first week after discharge if possible. Both in-person and telehealth video lactation consults are available. And I really encourage you to join the Milk Group. It's a breastfeeding and parenting support group led by a lactation consultant, available every week of the year, twice a week for free. The Milk Group is currently available on Zoom. At UCSF, we provide you with excellent care to best support you and your baby on your breastfeeding journey. Thank you.